You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. This is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations. And today our guest is Julie Grasson. Thank you for being here.
Thank you for having me.
We are talking about marketplace insurance, a little bit about Medicaid expansion, and it could probably be like a 4-hour show, but we're going to put it in 30 minutes or less. So thanks for being here. You've been here before.
Yes.
So marketplace insurance, people also call it Obamacare.
Yes.
So just so we all know what we're talking about. Who is this for? Who is it not for?
This is pretty much for anybody who's currently through the marketplace or anybody who is still uninsured, individuals that may be over income now for Medicaid.
Okay.
And starting in 2017, it will be for individuals that once had Medicaid spend down, who transitioned into Medicaid and are now truly over income for Medicaid expansion.
Gotcha. Okay. So this has nothing to do with Medicare, none of that.
Totally.
Okay.
Separate from
You can
Medicare.
change
We don't
the
do
channel.
Medicare world.
Okay, good deal. So this is something that's been around for a few years, and it is mandated, and there's penalties and things if you don't sign up for some insurance. Talk about that.
Correct. So each year, we are going into the 4th year of marketplace insurance. Sometimes it's referred to as OE4 now.
Okay.
With the requirement for insurance, individuals do have to have regular health insurance, whether it's through their employer, through Medicare, or through the marketplace or Medicaid.
Okay.
And with that, if somebody chooses not to have insurance and they do not have an exemption through the marketplace, those individuals will have a penalty when they go to file their next year's tax return.
Okay. And that penalty does keep going up every year, I know.
It does keep going up, and so for 2017, it will be $695 for an individual or 2.5% of their annual income, whichever is greater.
Okay. So there are penalties if you don't sign up. So this is, again, for people who don't have insurance through an employer, through Medicaid, through Medicare, people who kind of fall through the cracks and don't have insurance. Talk about the coverage. There's different levels still?
There are definitely different levels.
Okay.
It will go, the one I don't really like to talk about is a catastrophic plan.
Okay.
Those are truly only available for individuals that are younger than 30. And it truly is what it sounds like. It's catastrophic. It is if you are in a horrible accident, if you have a heart attack. Other than that, it starts at a bronze and goes up to a platinum.
Okay.
The care provided is all the same. It all boils down to your out-of-pocket expenses,
Okay.
so your monthly premium. If you opt for a bronze plan, your premiums are much lower, but your deductibles are significantly
Right.
more.
Okay.
If you go up to a platinum, you're going to pay more for a monthly premium, but your out-of-pocket, your deductibles are significantly less.
Okay. So a lot like just other commercial insurance, Medicare supplements, when you have a smaller monthly premium, you're going to pay more as you go along. If you have a little bit of a higher premium, that tends to cover more throughout the year.
Correct.
Is that right? Okay. And can somebody switch every year?
Most certainly.
Okay.
Open enrollment starts November 1st
Okay.
and will run through January 31st.
Okay.
So individuals that have a marketplace plan in 2016, now is the time to be shopping, going online, looking at all those different plans. We have navigators in 21 counties in Northwest Ohio that are there to provide free and unbiased assistance to really provide the education to really explore what each of the plans are. Are they covering their physicians? Is it covering their medications? And so for those that currently have a marketplace plan, if they choose to switch, they can do that all the way up until the end of open enrollment. But if they want that new plan to start on January 1st, which is the soonest any of the new plans can start, they have to sign up and make that selection by December 15th.
Okay, so from November 1st to January 31st, but if you wanted to start the beginning of the year,
December 15th is the deadline.
Okay. And are there networks within the each of the different plans? Like, do people need to know if their doctor takes a certain plan and all that kind of stuff?
Yes. One of the new features with healthcare.gov, which will be available starting this open enrollment, individuals can type in, actually manually enter, each of their physicians can actually enter in each of their prescriptions. And once you get all the way through the process and you're looking at monthly premiums, deductibles, all of that for all of the different plans, it's going to tell you which doctors are covered under each of those plans, which medications, which is a huge benefit, because in years past you would have to go through to a separate website and actually search the insurance carrier's formulary for prescriptions, and you would have to search their directory for physicians. So now it's very much streamlined for the consumer.
And what's that website?
Healthcare.gov. Or individuals can call 211 or the 800 number to schedule an appointment with a navigator.
So I think that was something maybe that a lesson learned from the past, probably, as it is with commercial insurance, Medicare plans, all that kind of stuff, is don't just go necessarily with the lowest premium, because the lowest premium might not cover any of your doctors, so that low premium isn't doing you any good.
And it may not even cover hospitals that are in your county.
Right.
One of the downfalls that we saw were people, especially down, I realize it's not here, but was down in Findlay. They were just picking what was truly the least expensive plan. Well, then come to find out their nearest hospital that was covered under their plan was all the way down in Lima. You know, so you really need to make sure that what you're purchasing is going to benefit you, and that the hospitals, the doctors in your area do participate.
Can a person go to, if they know an insurance agent in their community, or if they have an insurance agent for homeowners insurance or renters insurance or whatever, can they go get marketplace insurance through an agent? Or is that what they end up doing anyway?
They can go through an agent, a broker, or through the marketplace. The nice thing with a marketplace or meeting with a navigator is that none of the navigators are paid by any of the insurance carriers, so truly what they're getting is unbiased. You know, they're not going to try and sway you into one plan or another, because they don't get kickbacks.
Do you know premium ranges? I know it changes probably pretty dramatically every year.
It definitely has changed. We have seen projections for the this new open enrollment where a few plans actually had a decrease. But some plans have gone up by 25 to 30%. The one thing with those increases, you know, I don't want people to kind of panic, is that if you qualify for tax credits, generally speaking, those tax credits are going to absorb whatever that increase was. You know, so yes, you know, your premium may go up 10, 15 bucks a month, but you're not going to have that significant 30% increase out of pocket.
Talk a little bit about that before we take a break about the tax credits and all that kind of stuff.
So if anybody who's going through the marketplace, if their income is between 100 and 400% of the poverty line, they will qualify for tax credits, which reduces, it's like the federal government is paying a portion of your premium based on your income level. For individuals that are below 250% of the poverty line, if they pick that silver level plan, not only do they get the tax credits, but they'll also get what's called cost sharing. So the cost sharing reduces their out-of-pocket expenses. So their deductibles go down and all of that.
So it's starting to get a little confusing, and that's why we have navigators,
Exactly. You know, and navigators can help at any point in the process. If you need help going online and even creating the account, they are there. If you have already gone online, created your account, entered all the information, and you just really want somebody to help you look at each of those plans, they can do that as well.
Because I think people that don't speak insurance and don't do insurance on a daily basis might not necessarily think, does this cover every doctor? Does this cover my medications? Does this cover the hospital where I go to? You know, what is this? Can you help me figure out the budget? What's this actually going to cost me every month?
And that's truly what the navigator is there for.
And if a person wants to maybe try to do this on their own, it's all online, right?
They can do it online through healthcare.gov, or they can actually call the marketplace and apply over the phone.
Okay.
The one thing I would just really caution people is that if you're calling over the phone, you really need to know which of your doctors, your medications, you know, because we have seen instances where some people just pick the cheapest plan calling over the phone because they're not actually looking at what each plan covers.
Gotcha. So if someone were to call on the phone or do it online, you need to have in front, you know, who are all my doctors, what are my medications, how, you know, who's my specialist, who's my family doctor, all that kind of stuff.
Especially now, because it's just so much easier and streamlined that if you're entering in your physicians and your doctors, it all shows up on that final page where you're comparing plans.
Okay. So that it is getting a little simpler every year.
Much more user-friendly.
Good deal. All right, we're going to take a break, and we will be right back. About marketplace insurance and also Medicaid expansion a little bit. So you talked about in the beginning the enrollment, open enrollment, November 1st through January 31st.
Correct.
You have to sign up by December 15th if you wanted to start January 1st. If you wait till the end, coverage starts
March 1st.
Okay. So if you wait too long, you don't get penalized for, you know, that's the deadline is January 31st, but you could have a little bit of lapse of coverage?
Correct.
Okay.
You'll go 2 months, two additional months, because there won't be anything for January, February.
And if somebody wants to stay with their current plan, do they need to do anything?
I would definitely encourage people to still go online and just verify everything. There are several plans that were on the marketplace for 2016 that have been changed for 2017. And they were significant enough changes that those carriers have the option to just auto-enroll the existing consumers into the new one.
Okay.
But from the consumer side, they really need to make sure that that new plan is still covering the things that they were hoping it was.
I do some comparisons for Medicare Part D, and most other insurances, you just kind of go along with it, but there are certain things now that really could change. I mean, the formulary for your medications could be completely different, and that might not be the best plan, even though it seems to be.
Change.
Yes, everything's cool in 2016, but things could change for 2017. So even if it seems good, you encourage people to go online, get in touch with the navigator.
Because they may find something that, you know, is very comparable and cost saving.
Cover a few more meds. We also talked about in the beginning the penalties for not signing up and different things, but there are exemptions for people?
Correct.
Right? Okay.
So the federal government does have a pretty decent sized list of exemptions that are available, and navigators can assist individuals with those as well.
Okay.
You know, and some of the top ones are if somebody's had significant medical bills in the past 2 years, they may qualify for an exemption. If somebody has, in the past 6 months, had either an eviction notice or a utility disconnect, those are exemptions. If somebody is the victim of domestic violence, those are exemptions. And truly what the exemption means is that when they go to file their taxes for that year, they don't have the tax penalty for having been uninsured for that 12-month stretch.
Okay. But it's still worth talking to a navigator just to get things straightened out eventually.
Most definitely, because I mean, the last thing anybody wants to do is wait until tax time to try to do that exemption, because they're not, you know, rapid turnaround.
Right. Okay. Good deal. One of the nice things about marketplace insurance is that pre-existing conditions is not necessarily an issue anymore.
It's not an issue in any way, shape, or form anymore. So those individuals that have had diabetes, had heart conditions, had cancer, they're no longer, going to be paying higher premiums. They're no longer exempt from being covered.
Okay.
When the Affordable Care Act went into play, that went out the window.
Gotcha. That was a nice thing.
Yes.
For a lot of people who had those conditions. Plans. And I know there's, like you said, there's different bronze, silver, gold, and a catastrophic plans. Do they cover, we've been talking about doctors and hospitals and prescriptions, they cover, when you get a plan, it covers all that stuff, or potentially covers all that stuff?
Yes, that's the other nice thing with the Affordable Care Act. When that went into place, many services became a covered entity, so it doesn't go against somebody's deductible, they're not paying out of pocket, and that includes their annual flu shot, an annual physical with their primary care doc. For women over 40, it includes an annual mammogram. For individuals over 50, it includes their screening colonoscopies.
Okay.
So there are definitely things within every plan that are now automatic at no cost. It's a true benefit because they have that carrier, that plan.
Okay.
There's no out-of-pocket cost. And
okay. And we also talked about, open enrollment and when that is and when the coverage starts. But throughout the year, things could happen. They call them qualifying events.
Yes.
Talk about what those are and what that means for somebody.
So a qualifying event then leads into a special enrollment period.
Okay.
A qualifying event could be aging off of your parents' plan when you turn 26. It could be moving from one county or one state to another. It could be getting married, getting divorced, losing your employer-sponsored coverage, having a baby. There is a very long list of those qualifying events. With regards to qualifying events, individuals have 60 days from the date that event happens to go into the marketplace, pick a plan, and get enrolled into a new coverage. So you have 60 days to make it happen. However, you can go into the marketplace 60 days before you know what's going to happen.
Okay.
So if somebody, heaven forbid, their company's shutting down.
Right.
And they know that their termination date is a month from now, they could log into the marketplace, create their plan, so that literally the day their employer-sponsored coverage ends, their marketplace plan is kicking in.
Okay.
So there's no lapse in coverage.
So some of those things when you're pregnant, 60 days before when you're going to have a baby generally, and so you can do that, or employer-sponsored insurance, that kind of stuff, or if you're getting married or whatever. So if that happens, if you're getting married in April or you're having a baby or something is happening in the middle of the year, you have 60 days from whatever that event is to get a plan.
Correct.
What if you wait too long? Do you have to wait till open enrollment then?
No. Oh, yes. So if you go 61 days and you're like, oh, I should have done it, now you're kind of up a creek unless you have another qualifying event or until the next open enrollment. But the thing to keep in mind with open enrollment, yes, it starts in November, but the soonest that coverage is going to kick into play is the following January.
Okay. So
it's not an
do
instant.
it in those 60 days is the moral of that story. Talk a little bit about, in addition to marketplace insurance, navigators also help with Medicaid expansion when that happens. Talk a little bit about what that is and how it works and how a navigator can help.
So one of the things, in the data is still kind of iffy because it's all based on the 2012 census. But there is still a significant number of individuals that are eligible for Medicaid that haven't signed up. And so for a single person, if they're making less than, I want to say it's like $16,300 and some odd dollars, they're eligible for Medicaid. Medicaid is strictly an income-based program. So people no longer have to be age, blind, disabled, pregnant in order to qualify. And navigators can certainly assist individuals with that application. If it's a single person, it's probably a 30-minute appointment. But then the other thing that individuals need to keep in mind is that they have to renew and requalify every 12 months. And so it does not go on the on the marketplace open enrollment period. It is literally 12 months. So if somebody signed up in July, the following July they have to recertify. But navigators are available to help individuals with that, whether it's the initial application or the recertification. And navigators have also been around to help people with appeals if they really believe that they're eligible for Medicaid. You know, a perfect example of that, we have, you know, many individuals that are seasonal farm workers.
Sure.
So yes, their income is higher during, you know, the summer months or fall months, but then it really drops off for winter and spring. Medicaid generally looks at the past 3 months of income. So if somebody's signing up in August, based on the past 3 months, they may be over income.
Okay.
But navigators have helped individuals with those appeals and worked with them to get, you know, documentation from their employer that says it's truly 12 months and this is the annual income.
Okay, gotcha. Spend down. You mentioned in the beginning, so if someone was on Medicaid through Job and Family Services and had a spend down, and those people know, you know, what that means, some of that has changed, and some of those people might not be eligible necessarily for Medicaid, but would qualify for Marketplace?
Yes. So, spend down ended August 1st.
Okay.
And individuals that had met their spend down 12 months prior to that at any point were rolled into Medicaid expansion.
Okay.
That rollover is only into play until their renewal date in 2017.
So again,
That
July,
and-
June,
yep.
May, whenever they signed up, 12 months? Okay.
Yes. And as I just said, Medicaid is truly an income-based program.
Right.
So individuals that had spend down and now transition to expansion may be over income
Okay.
to remain on expansion.
After
And-
that 12 months?
After that 12 months. So on their renewal date in 2017 is when they may very well be needing a navigator because they're not going to qualify for Medicaid in any form. The one thing I really encourage everybody, whether you are somebody who's always had Medicaid or if you are an individual that had Medicaid expansion, call your county JFS, find out what your renewal date is. When you call JFS, you can let them know what your annual income is, and they'll be able to tell you whether or not you'll be over income upon your renewal date.
Okay.
And if you are over income for your renewal date, get in touch with a navigator and they can get the ball rolling so that you don't have a lapse in coverage.
So theoretically, somebody's renewal date could be January 2017.
Yes.
And so if they can find that date out, they need to get with a navigator now, just like people who are in open enrollment for Marketplace, even though they're in a different category, so to speak. And they need to get with a navigator to get a Marketplace plan if they don't want to have lapse in coverage.
Right. You know, so for those individuals that were spend down that transitioned to expansion who are really over income, if their renewal date is in January, those individuals technically have that 60 days. So they could still be applying in March. Because that is now a qualifying event, they have lost coverage.
Gotcha.
So if somebody, you know, if their Medicaid is now ending their over income in March, they have May to sign up. They get those 2 months. But if you know in advance that you're going to be over income,
Right.
you can start the process before that 60 days so that you don't have a lapse.
So if it's February 1st is their renewal date, but they have 60 days, so they have February and March, but the coverage doesn't start back to their renewal date. It's not retroactive. Does it start the first of the following month?
It will. It all depends on when they sign
Okay.
up. So if somebody's coverage ends February and they sign up before February 15th, their coverage will start March 1st.
Okay.
If they wait that full 60 days, their coverage won't start until April.
Okay. So even though you have 60 days, you still might have a lapse of coverage if you wait till the end of that
Yes.
60 days. So the moral of all of this is call a navigator.
Call a
Kind of.
navigator,
Call
call-
211, call the 800 number. We're gonna
And
put all
call
those
your
on-
county JFS and find your
Yes,
renewal
find
dates.
out your renewal date. That's really important.
Yes.
JFS is probably like, wait, hold on, you're gonna get maybe bombarded with calls. We'll see how many people watch. Okay, any final thoughts, any final things you just really want people to know about Marketplace Insurance or Medicaid expansion?
The biggest is just knowing those enrollment dates, that November 1st it starts. The final deadline is January 31st, but if you want coverage to start the beginning of the year, you have to sign up by December 15th.
Okay.
If you wait until the January 31st, your coverage isn't starting until March 1st.
Okay.
So those are the keys.
So there's lots of resources out there to help people. They just make
Most
a call, get online. Okay, thank you very much.
Thank you for having me.
All right, we're going to take another break and we'll be right back. And we're back. I want to thank Julie for being our guest today. Lots of information, things changing a little bit, like they always do with insurance. I guess the biggest moral of this story is being aware, knowing your renewal dates, shopping around, and reaching out to these resources. So healthcare.gov is the website somebody might go to set up their profile and everything to sign up for a marketplace plan. Anybody with questions, wants to meet with a navigator, kind of wants somebody to walk them through, is my doctor covered, are my prescriptions covered, call 211 or 1-800-648-1176 to find a navigator, or our local navigator. Her name is Marnie and she's wonderful, and her number is 419-349-1778. So there's lots of resources out there. Make a call, get online, talk to a caseworker, whatever needs to be done. If you ever have feedback about a program, or if you have a suggestion for a future episode, please let us know by sending a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452, or you can email Mrs. Pelz at the high school, cpelz@pccSD-k12.net. So, think about something you learned today, all this information, whether it's something you need to know or something that someone you know and love needs to know. Be sure to share the information. And until we meet again, I encourage you to make time for health.